Hey docs! Okay, today we are going to do MRT of the low back. Let's get started. All right, as we have discussed before, just a little bit of emollient. Doesn't have to be a lot, right? Doesn't have to be a lot here. I always like to make sure that I have a towel or some sort here, especially for your patients when they come in. They might be coming in on their lunch hour, right? You don't want to get stuff on their clothes. So you can just tuck all that stuff in here, let them know that you're doing that real quick. And then now you don't have this whole thing where you could get all this emollient on their clothes and things like that, which just makes it a mess for your patients. All right, so we're gonna apply the emollient. And I always like to make sure, right, that the soft tissue that we're doing is gonna have some type of purpose. So what you're doing here, remember, is that you're finding that SI joint. So just like we had different pinpoints that we've been looking at in the other videos, the SI joint's our marker here. Go right above it. We're gonna start on just these paraspinal muscles right here, just these major extensor muscles. First thing you're gonna do is just some cross friction massage, just back and forth. That's all you're doing. You're literally just going back and forth, all the way up the belly of the muscle until you start to reach that kyphotic curve of the thoracic spine. Then you're gonna come back down. I always like to think of it as like a typewriter. Watch. Ding. I mean, you know, make it fun. Anyhow, so that's the first part. The second part to this, one of the bigger muscles, is gonna be that QL muscle that's coming right down here. Now we really wanna make sure we get this thing because it's a major stabilizer and a major player when you have low back pain. Find the SI joint, place your thumb of your contact hand, and that will be the hand probably not closest to the patient, but that opposite hand is what I prefer to do. Cover it with the other side here so that way you can add a little bit more pressure. Ask the patient to take a deep breath in, and as they exhale, you're gonna push in and down and strip through the muscle belly, going down kind of in a nice little angle here, and you can even strip all the way up the paraspinals, adding a little bit of extra pressure to loosen up, right? As always, don't forget to do this bilaterally, but that is MRT of the low back. Let's get to work, docs. Peace out.